Hi, just a quick video about rib injuries. Had a client come in recently and they didn't know that if they had a bad injury to the ribs, that one of the biggest problems that could happen from that is they could potentially get pneumonia. And that's because your breathing is compromised and they're not breathing as deeply as you normally would. So the first thing to do, if you have any pain in the ribs, normally it will reveal itself when you sneeze, when you're breathing, twisting, any shooting pain around this area, and obviously if you had a fall and you feel like you've cracked your ribs, go to the doctor, your health professional, or even a hospital to just make sure that that's checked out. Because you have cartilage here and you have bone, the bone can crack and then actually puncture the lung. So you need to have that checked out. Shooting pain, obviously, that means you need to go to the hospital. Well, let's assume that you've done that and you have been told that the lungs are looking okay, but you still have some damage in the ribs or the intercostals, which are the muscles between the ribs. And you need to make sure that you are fixed and fully back to health within about 6 weeks. You'll need to do some exercises, and that's because scar tissue will form, and if you do no exercises whatsoever, then you're going to lose some mobility and your breathing is going to be compromised. So these are some simple exercises to make sure that if you have any rib injuries, that the repairing and healing is as good as it can possibly be. So let's have a little look at what we can do. So the first thing is deep breathing. This is really good because it expels all the air and oxygen, water in your lungs. And the best thing to do is to put your hand on your belly, breathe in through your nose, and breathe out through your mouth. So you need to do about 20 deep breaths. And this will make sure that your lungs are fully functioning and expelling everything that they need to expel. This might be slightly painful, but obviously if it's a shooting pain, just stop. But you need to get your deep breathing exercises 3 times a day, like I say, for about 20 breaths. And if you do that, you will see some improvements. The next thing is to get some mobility into your ribs. Your thoracic spine is attached around the back to the ribs. So one thing we need to do, sit down, make sure that your hips are locked, and you can get a broomstick or plastic tubing, anything that's straight, and then you can just twist and twist. Again, 20 reps 3 times a day would be fantastic. Now, if you go to one side, oh, that really hurts, then make sure you go the other way and then try and bump back. And eventually you will find that you can go all the way on both. So that's really handy. A couple of stretches you can do, because obviously we've done some rotation. We now want to make the ribs open up a bit. We can just lean back on a chair and we can just lean back. And that would be really handy. Again, you're looking at about 20 reps 3 times a day. So you're just going to stretch back like that. That's fantastic. And it's opening up this area here, which is really good. Then you can go on to a thing called picking the apple, which is just imagining there's an apple and you're picking it off the tree and bringing it down. And obviously that stretches the side. And you can then alternate. So if you're looking about 20 reps again. And this will give you a fantastic range of motion and make sure the scar tissue is nice and elastic. Finally, once you feel that you're comfortable with those exercises and you're not feeling any pains really, you could then look at putting the apple in a basket and going across the body as well. So you're picking the apple, placing it in a basket, picking an apple and placing it in the basket. And all those things should help you repair your ribs, your intercostals as best you can. Hope that was helpful.